Good afternoon, everyone, and thanks for inviting us to present the data of our recent study. Emerging viral infections in humans have been reported with increased frequency in the recent years. Previous evidence highlights the importance of demographic change, global travel and trade, and possibly climate change as drivers for emergence. In particular, many emerging diseases arise when infectious agents in animals were passed to humans because of the expansion of population in number and into new geographical regions. Since the 1970s, about 40 infectious diseases have been discovered, including SARS, MERS, Ebola, chikungunya, avian flu, swine flu, and Zika. Among the emerging infections, the attention has focused on coronaviruses, responsible of greater global concern since the beginning of the 21st century. Before 2003, two human coronaviruses, OC43 and 229E, were known to cause mild illness such as common cold. The outbreaks of severe acute respiratory syndrome and the Middle East respiratory syndrome revealed how life-threatening a coronavirus infection could be. And as you all know, at the end of December 2019, COVID-19 outbreak, a highly infectious respiratory disease caused by a new coronavirus known as SARS-CoV-2, increased once again global concern for human public health. Given the rapid transmission of the virus, it is necessary to investigate the possibility of repurposing existing drugs as potential antiviral and or viricidal treatment against SARS-CoV-2. On the light of the aforementioned consideration, propolis have been shown as a good candidate for inhibiting viral replication, as well as for its viricidal properties. Indeed, propolis has shown to inhibit flaviviruses, herpes simplex viruses, and so on. However, none of these studies have been focused on coronaviruses. In this slide, you can see the propolis compound obtained by the Binatural company. In particular, these propolis extracts are based on the preparation of non-ethanolic polyphenolic mixture rich in reactive compound and highly purified from impurity and inert materials through the extraction of popular type raw propolis selected and worked in accordance with the innovative dynamic multi-extraction patented method. Also, the production of non-ethanolic propolis extract is focused on the solubilization of the active molecules of propolis in aqueous or oily solvents. In particular, the MED method of extraction consists of aqueous extraction from dewaxed raw propolis, extraction on the residue using an ethanol water mixture, with each extraction being carried out on the residue from the previous extraction using a higher percentage of ethanol, mix of the combined extract and concentration by distillation to a residual humidity value ranging from 50 to 20%, the concentrated extract then analyzed by high-performance liquid chromatography and submitted to an antimicrobial assay. Several studies have been performed using Propolis M.E.D and that in different biological properties have been confirmed, such as ability to modulate the oxidative stress and inflammation, and also antiviral activity against enveloped RNA viruses, such as herpes simplex viruses 1 and 2. Moreover, a recent study performed by Dr. Cristina Esposito et al. Have revealed the effects of a popular type of propolis, namely Propolis M.E.D oral spray, in the remission of uncomplicated upper respiratory tract infection symptoms. In particular, the study was conducted in 122 healthy adults who had perceived mild upper respiratory tract infections. Participants randomly assigned to receive the either propolis oral spray or placebo. After 3 days of treatment, 83% of subjects treated with propolis oral spray had the remission of symptoms, while 72% of the subjects in the placebo group had at least one remaining symptom, suggesting that Propolis M.E.D oral spray can be used to improve both bacterial and viral uncomplicated upper respiratory tract infection symptoms in a smaller number of days without the use of pharmacological treatment, leading to a prompt symptom resolution. The Propolis M.E.D extract used in the study is a hydroalcoholic solution containing vegetal glycerin at 10%. Flavonols as chrysin and epigenin, flavonones as pinosembrin and pinolbenzkin, and flavonols as galangin, the major component, quercetin, camphorol, were found as the most common components on the basis of their UV and mass spectra. The concentration of the main flavonoid species resulted to be about 40% of the total polyphenols content. Therefore, the main of our study was to determine the viricidal activity against different RNA viruses, classified as enveloped RNA viruses, including vesicular stomatitis virus and coronaviruses such as the feline coronavirus FCoV2 and the low pathogenic human coronaviruses OC43 and 229E, and also to determine the viricidal activity of propolis extracts against naked RNA virus such as encephalomyocarditis virus. To evaluate viricidal activity of the propolis extract, FCoV2, OC43, 229A, VSV, and EMC viruses were exposed at different concentration of Propolis M.E.D oral spray and at different times of contact, 5 minutes, 15 minutes, 30 minutes. Thereafter, viral titer of each virus was assayed in a specific cell culture. OC43 and 229A titer was evaluated by real-time PCR, while the median tissue culture infectious dose of VSV, EMC, and FCoV2 were titrated in cell cultures. Viral titers of propolis-exposed virus were compared with control virus titers tested under the same set of conditions without extracts. The results indicated that Propolis M.E.D extract inhibited VSV titer just after 5 minutes time of contact with the virus, leading to a viral titer reduction greater than 99.9%. The same results were obtained after 50 and 30 minutes of contact with virus. As you can see here, the exposure to propolis extracts caused a reduction of FCoV2 infectivity of 19% after 5 minutes of exposure, but viricidal activity of propolis against FCoV2 increased when used at 50 mg per milliliters starting from 15 minutes of contact with virus, thus leading to a reduction greater than 99.9% of titer. These results showing a high viricidal activity of propolis extract against enveloped RNA viruses were also confirmed evaluating the viricidal activity against two low human pathogenic coronaviruses such as OC43 and 229E. In the second part of this study, we also evaluated the viricidal activity of propolis M.E.D extract against a naked RNA virus, such as EMC virus. But as you can see here, this propolis extract did not show it viricidal activity against this virus. Overall, our result demonstrated that propolis extract exhibits strong viricidal activity against different enveloped RNA viruses, including coronaviruses. The viricidal activity of the propolis extract is time and dose dependent, and propolis extract do not show it viricidal activity against naked RNA virus. Considering these findings, our results are thought preliminary, may suggest that Propolis M.E.D extract could be used as a possible preventive agent for respiratory virus infections. In conclusion, as you know, the worldwide COVID-19 pandemic has a renewed interest in Propolis products, recommending a favorable role against COVID-19 outcomes. Therefore, the purpose of our ongoing studies is testing the viricidal effect of this Propolis M.E.D extract against SARS-CoV-2. Thank you all for the attention.